Hi, my name is Joseph Stramondo, and I am an assistant professor of philosophy and associate director of the Institute in Public Affairs at San Diego State University. I specialize in philosophy of disability and bioethics. I also identify as disabled. I have a spinal cord injury as well as a rare kind of dwarfism, and so you get two for the price of one with me. So my first memory of discrimination um, was, well, it's hard to say. I have lots of memories as far as the experience of stigma or bigotry, mostly around my dwarfism. And so, I have lots of early memories around that with children staring and laughing and this sort of thing from a very young age. Um, and then, as far as sort of more systematic discrimination that sort of excluded me from something that I wanted to do, um, I had a pretty good experience as a child, mostly because my parents really did a lot to make sure that I was included. I can remember being in Boy Scouts and Cub Scouts when I was a kid, and my father really doing a lot with me to ensure the inclusion of my disability. Going on camping trips with me and sort of acting as a personal attendant kind of thing to make sure that I was able to go and participate in this sort of thing. Um, and so the first real experience of exclusion that I can remember happened when it was time to go to high school. I had gone to the public schools in my town up through the 8th grade. And then when it came to high school, I was supposed to go to the same private, religiously sort of oriented school that my older siblings went to. And I took the entrance exam, and I even got a small scholarship to go and everything. But it didn't have an elevator, and so I used a motorized scooter to get around, and it was going to be impossible for me to attend that school because there was no elevator. Now, this was actually after the passage of the ADA, but because it was a religiously oriented school, it was exempt from the requirements of the ADA, and so I didn't have any leverage with that law to be able to get them to make accommodations for me. And so I ended up going to the public school in my town, which actually, personally, I was pretty happy about anyway, because that's where all my friends were going. But it still sort of clued me into the fact that not everything is accessible, not everything is designed for me, and that this was going to be something I was going to have to figure out throughout my life. As far as um, remembering the ADA and sort of its passage and this sort of thing, I was pretty young when it was passed. I'm sometimes referred to as part of the ADA generation, which means that I sort of grew up with the ADA mostly. I was born in 1982, and so I was 8 or 9 years old when the ADA passed. And so I don't really have any kind of recollection of, aha, that's the moment that it passed, and the recall of where I was at the time or anything like this. But I do remember my father explaining it to me around the time of my start of high school, when I experienced this with that private Catholic school. And having that sort of systematic discrimination experience, he explained that public schools and other kinds of public places were accessible to me because of the ADA, and that there was this law that said that things had to be accessible to people who use wheelchairs and motorized scooters like I did at the time. And so that was my first sort of awareness of the ADA, as well as my first awareness of discrimination, which is kind of cool, I think, because it was neat to have that experience of, okay, well, this is something that's going to be a challenge for you, and here's how you're protected, and here's how you can do something about it. And so, in a way, it was just sort of my awakening into advocacy as well. As far as the difference that the ADA has made in my life, or the life of others, I think that it's been, um, of course, an incredibly important law that has opened up all sorts of opportunities to people. Um, Everything from public transportation, to be able to move around your community. Um, the Olmstead decision is based on the ADA, which says that people need to be, when they need any kind of long-term care, need to be served in the least restrictive environment, meaning that you can't just institutionalize or warehouse somebody because it's more convenient for you, that you need to make sure that they are able to live in the community or somewhere that is going to be best for them. What else did the ADA do? Just the ability to, um, get an education, the ability to get a job, all of these things, for me and for others, were sort of caused by the ADA. And I can't really imagine what it was like prior to the ADA, honestly. I mean, I can imagine it, I guess, but I'm sure glad that I didn't have to experience it. So the ADA makes a difference in a wide range of personal experiences, and also a wide range of sort of um, disability politics issues, right? So my um, personal experience that I think uh, most recently has been impacted by the ADA has been um, just my ability to live an independent life with my two kids. I think prior to the ADA, it would have been much harder to do that. Raising kids means that I have to go into lots of different public spaces and do different things that I might not have been, um, required to do, if you will, professionally or just sort of in everyday life if I didn't have them. So going to the zoo or going to the grocery store, or, at last minute item, or, just whatever it might be. Um, I think that, opening up even, their daycare centers and so on and so forth, the ADA sort of opened all of that up to me as a wheelchair user. And so that's where it's made a big personal impact in my life recently. I think that one thing that I can sort of speak to professionally about the ADA and its impact or lack of impact is probably twofold. One is the ways in which um, my privilege as a physically disabled. There's a disability hierarchy, of course, and so physical disability is usually at the top of that hierarchy, with psychiatric disabilities and intellectual developmental disabilities sort of lower down in the hierarchy, right? And so, as a physically disabled, cisgender, heterosexual, white guy, I've benefited a lot more from the ADA than lots of other people that don't have those kinds of privileges. I think, for instance, about how the ADA is designed really to promote what we would think of as equality of opportunity, meaning that everybody has an equal opportunity to compete within sort of the economic life of the United States. And so, it allows you to, enter into the workforce and enter into the educational system and so on and so forth to compete. But what it doesn't do is it doesn't address any of the other advantages or disadvantages that intersect with ableism. And so that's sort of something that is, I think, a real problem with the ADA. I'm, a well-educated person. I have a master's degree and a PhD. And that I don't think would have been available to me as easily as it was if I didn't have these other privileges that I do have. That the ADA doesn't do anything to address. It just sort of treats all disabled people as if they were the same, and as if the only thing they have to deal with is structural ableism, and that's just not true, right? I think another thing about a that it doesn't address is economics, in that I think that, despite the ability to compete, a lot of disabled people still live in extreme poverty because of other things that make it impossible for them to compete, other than just their disability, right? And so the real sad part to me about that is you look at other systems that are designed to help disabled people get out of poverty, and even they don't recognize the way that privilege operates in these contexts. So, for instance, the vocational rehab system. I've benefited greatly from the vocational rehab system, so I don't want to just sort of sit here and talk smack on it, right? The vocational rehab system has helped me get a van that I could drive, so I could get back and forth from my place of employment and from school, which was huge, right? But the only reason why I had access to that van was A, because I could afford the van itself, which not a lot of disabled people can do, especially if they aren't working yet. And B, because the voc rehab counselor thought that I was worth the investment, right? Someone who didn't have, the advantages that I had, as far as the kind of disability that I have, my, my family's resources, and my skin color and gender and all those things, it's very likely that the rehab counselor would have said, you can take the bus, right? We're not going to invest all of this money into helping you learn how to drive, because they wouldn't have believed that they would get this return on their investment, that the person would be able to get a well-paying job, and so on and so forth. And so I think that that's also a big issue that the ADA doesn't address, is this kind of intersectionality that gives some disabled people advantages within even the system that is designed to help them, and other people, of course, disadvantages, which is a real issue. Now, as far as my area of expertise, bioethics, there's definitely been some ways in which the ADA has helped greatly, and other ways in which it hasn't really done much. So I'll start with the positivity, right? We'll start with the good news. So one way in which I think, I can point to a very sort of concrete way in which the ADA has helped is when it comes to healthcare rationing. So the issue of healthcare in the United States, of course, is a very hot button topic, and it's hot because there is sort of a perceived lack of of resources. There's more need than there is supply for healthcare. And so when we talk about expanding healthcare to a larger number of people, without also expanding the resources that are being devoted to healthcare, then that's going to be a real problem, because some people aren't going to get as much as they need, right? You're going to have to sort of budget it, if you will, or in the terms of bioethics, ration healthcare. Now, this proved to be an issue because when it was done on smaller scale, for instance, the state of Oregon, after the passage of the ADA, I'm not sure exactly on the timeline, I'm not a historian, but the state of Oregon expanded their publicly provided healthcare to a larger number of people. And as they did that, they needed to make sure that they had a way of prioritizing what was covered and what was not covered. And so as they did this, it became apparent that a lot of disabled people were being rationed out of the healthcare system. That a lot of things were not being covered for disabled folks that should be. And so there was a series of lawsuits that were brought against the state of Oregon that basically said that you couldn't discriminate against disabled people and not provide them with health care based on their disability. That you couldn't just sort of say, well, you know, this person isn't going to get very much bang for their buck. They're not going to end up being healthy anyway, because they're still going to be disabled. And so we're not going to give them this treatment option, right? And so that was a big win within bioethics. That was a direct result of the ADA. More recently, we've had a similar thing pop up because of the COVID-19 pandemic. Specifically, there are what are called emergency healthcare protocols that are being developed for hospital systems and states that anticipate needing more intensive care unit beds, ventilators, and so on and so forth than are actually available. And so we need some way of figuring out who gets the ventilator, who gets the intensive care unit bed, and so on and so forth as the pandemic increases and goes on. And so there was some protocols that were developed that were very discriminatory against disabled people. There was one in Alabama specifically that said that anybody with a intellectual disability or with dementia was going to be deprioritized from getting these life-saving resources if they got COVID-19. And there was one in Washington State that was pretty discriminatory against disabled folks and said that if you had a disability that meant that even after treatment you were still going to be disabled, that you would be deprioritized from getting the life-saving, life support kind of treatment for COVID-19. And so there was a variety of these all over the United States that were really problematic and that explicitly were discriminating against disabled people when it came to getting treatment for COVID. And so in response, there were some folks from protection and advocacy agencies, which are sort of these Disability Rights California is one, and each state has protection and advocacy agencies that are sort of federally funded nonprofit law firms that protect the rights of disabled people. And so they sued these states and these hospital systems and got the federal government to provide guidelines for treatment rationing protocols that basically say that you can't discriminate against disabled people in this way. That you, the only time that you can withhold treatment for COVID-19 is if there is sort of a very clear way in which the disability means that the person would not benefit from the treatment, that, you know, they have the kind of disability that would make it very, very unlikely that they would survive the virus even with some kind of ventilator or intensive care situation. Of course, this is a really good thing that these protocols were changed, because there were a lot of them that would have rationed people out for reasons that had nothing to do with whether or not they'll survive the virus with treatments, right? So whether you use a wheelchair or you need a personal attendant for things like dressing and bathing, whether or not you have a intellectual disability, these are reasons that were being used to deny people treatment for COVID-19 that have nothing to do with whether or not they would survive the disease. And so these advocacy efforts that were based on the Americans with Disabilities Act sort of made that illegal to do, which is, of course, a really important thing, and it's literally saved people's lives. There are lots of ways in which bioethics can and has been discriminatory toward disabled people in ways that isn't addressed by the ADA, and that really can't be addressed by the ADA because of the way it's written and the kinds of problems it was designed to solve. For instance, there is a lot of controversy over the development of different reproductive technologies that are designed to prevent the birth of disabled children with intellectual disabilities, with, you know, like Down syndrome, with disabilities like mine, dwarfism, with disabilities like certain kinds of genetically linked deafness, and so on. And so, you know, we have an entire industry aimed at genetic testing for these kinds of disabilities and the prevention of the birth of children with these disabilities with, you know, selective abortion, or now selective implantation, which is when you test embryos and then pick the one that you want to give birth to. And then coming down the pipeline is CRISPR, which will be a technology that doesn't select a particular embryo, but rather modifies the embryo itself. And it's sort of what's sometimes referred to as gene editing or genetic engineering. And that isn't a reality yet, but scientists are certainly working toward the use of that technology to prevent disability. Now, it is something that, of course, makes a lot of people with these disabilities very uncomfortable because of the message that it might send, right? It might send the message that, well, people like you aren't wanted in the world, right? We don't need more like you. And so it is sort of based on largely stigma around disability, around ideas about the quality of life of disabled people, that if you have a disability, you must be miserable. And so we must do everything we can to prevent more like you from coming into existence, and so on and so forth. Now, this is a real problem because, of course, it is comes into conflict with values a lot of people hold around reproductive liberty, around women being able to make choices for themselves about their own bodies and about their own lives, and so on and so forth. And so this has sort of created a tension between um, disability bioethics and uh, other kinds of progressive groups that are wanting to um, promote freedom and justice for everybody. And so the ADA, isn't designed to handle something like this, because it's not sort of about overt discrimination against people, but rather it's about attitudes. It's about beliefs about disability that drive personal decisions. And so it's really, really hard to address this as a policy problem, because people aren't going to be very keen on restricting the kinds of decisions women and families can make about reproduction. But at the same time, we want to promote good beliefs and true beliefs and good attitudes about disability and the ways in which it contributes to the world, and the ways in which disability is a form of diversity that's important, that we don't want to eliminate. And so that, I think, is a task for folks like myself in bioethics that are writing about these issues, that are trying to make arguments that are able to walk this very thin line between saying, okay, disability is the kind of thing that is not a horrible, life sentence of misery. And so we don't want to make that assumption, and we don't want to, base the technologies that we develop or the decisions that we make on that assumption. But at the same time, we don't want to tell people what they can and can't do with their bodies. I think that if I were to pick one thing to change, to try to give people with disabilities more access, and to remove barriers to a life of flourishing and opportunity for disabled people, I think I would go back to my my birth story, my origin story, if you will. Um, when I was born, the doctor that delivered me um, looked at my body, and he had never seen somebody with my kind of dwarfism before, and didn't know much about it. And he told my parents, he's not gonna do much. He's not going to be able to walk. He's not going to be able to talk. He's not going to be able to go to school, and so on and so forth. You should place him in a state institution, and go about your lives. Forget about him. And they didn't do that. Obviously, they chose not to do that. They took me home. They raised me like like their kid, because I was their kid. And so I think a lot about how different my life would be if I had been institutionalized from birth, as that doctor recommended. And then I think about how these institutions still exist. That, when I was, before I entered academia full time, I worked as an advocate for a protection and advocacy agency in the state of Texas, where they have what are called state-supported living centers, which are just sort of a euphemism for state institutions where they warehouse people with intellectual disabilities and psychiatric disabilities of various kinds. And, basically the kind of place that the doctor was recommending my parents put me. They still exist almost 40 years later. This is not okay. And it's not just these kinds of places that are really problematic. Nursing homes, there's lots of disabled people in nursing homes. Even some group home systems that are corporate, that are designed to make money, and not to make sure that the people living there are actually living good lives, right? This is a serious problem when you take people and you put them in a situation where they don't have control over the basic decisions of their life, what they eat for their meals, when they wake up, when they go to bed, how they spend their time, what they wear, right? When I was working as an advocate going into the state institutions in Texas, I remember sitting in a meeting where it was discussed about my client's eating habits, and how part of his behavioral support plan was that they had his helper try to get him to take a sip of water between every bite of food that he took during mealtime. And I thought to myself, how absurd. This is a grown adult person that they are trying to micromanage down to the very last detail of his life, and trying to control everything about what he does. That's horrific. I can't imagine living under that kind of condition where, I'm not even able to eat my meals in peace without someone telling me what to do and how to do it, right? And so, I think that this lack of control over basic decisions of your life is a real problem for a large number of disabled people still, even 30 years after the passage of the ADA. And so if there's one thing that I could just sort of wave a magic wand and change, it would be that. It would be developing systems where people are truly supported to be able to flourish as they are, but not controlled, right? Not told what to do and when to do it every moment of their lives, where they can make their own decisions and have agency over their own lives. I think that's what is missing for a large number of disabled people still, even after the ADA, and that we need to do something about that. I think that there's a few things that we can do. First, educate yourself on the issues, right? Educate yourself on the issues beyond just how they affect you, right? I think that within the disability movement, there is sort of pockets of different people doing different things, and that's fine. But I think we need to talk to each other more. We need to realize that disability issues go beyond our limited experience, right? And so we need to be aware of the ways in which disability disadvantages people differently, that the experience of disability is not an experience, it's many experiences. And so we need to listen to each other and hear from each other about the ways in which we are suffering and hurting because of disability discrimination, because it looks very different between different people. And so having a richer, fuller understanding of the problem, I think, is the first step. And then beyond that, just sort of talking to people about, strategies that they have, and learn from each other about, maybe some strategy that worked for, the deaf community would work really well for the dwarf community. And maybe we haven't talked to each other very well about different political strategies to try to get what we need in order to live well. And maybe we should, right? So educate ourselves about the struggle of others, because it's important to know, and then share information and share strategies on how to effectively advocate and come together and fight together, right? If you show up for someone on issue A that they're having, then they're more likely to show up for you on issue B that you're having. And so building solidarity across the movement more effectively, recognizing the ways in which other oppressions intersect with disability and change the nature of disability oppression. These would be my recommendations of what to do. Just basically raising your awareness of discrimination beyond just your own experience.